During this season, you may have other health issues which are not related to COVID-19, and you may need medical attention, as likely may have happened in previous years when you've been here. So some examples may be a shoulder strain, maybe heat exhaustion. You may have an infection. You may have high blood pressure, diabetes, or you may need a prescription for a medication that you need and take on a regular basis but have run out of. There are several clinics in Ontario that offer non-emergency health services specifically for international farm workers. Most have translators, and you can contact some of them directly through WhatsApp. They are offering services over the phone and in person if you need it. And I'm going to give you a list of their contact information in a few slides. For many services, you do not need to present your your green card if you don't have it. That is specifically related to the health clinics that offer services for temporary foreign workers. You do not need your health card to access their services. There are other services, though, that you can access if you don't have one of those clinics in your area. The first one on here is, again, a telephone number that's referred to telehealth. When you call there's a long message at the beginning in English and French, and you need to wait for a person to answer and ask for a translator if you need one. Telehealth is answered by nurses who will ask questions and give advice about seeking healthcare in person, and may be able to assist with access to healthcare at other locations. OHIP cards are optional with telehealth. You do not need to give your OHIP number if you do not have one. In other areas, there are urgent care centers or walk-in clinics to help. Some walk-in clinics are open now, most are not, but the urgent care centers are open. And you may need help from your employer or a community advocate or a friend to assist with visiting these clinics. You will need your OHIP card for these services. There's also a large number of online non-emergency services that have opened up or have appeared online, shall we say, once all the walk-in clinics were closed. And so most of these services, the vast majority of them, are only in English. I have not found any that have translators. And what you need to do for these services is that you have to connect with them online. You have to fill in information online and provide your OHIP number. And then usually they call you back. And most of the assessments are usually done over the phone. But some workers have used them and have found them helpful. So here are the clinics who offer services specifically for temporary foreign agricultural workers, and they're listed by region. In the Beaverton area, the services are presented by the Brock Community Health Center, and the contact number is 416-886-4482. In the Port Hope area, the service is provided by the Port Hope Community Health Center, and their contact number is 705-808-3124. In Niagara region, the telephone number is 905-328-1546 via phone, text, or WhatsApp, and that service is provided by Quest Community Health Center. If you need one of these phone numbers, please pause the video and you will be able to write it down. In Norfolk, Simcoe, Delhi area, the service is provided by Grand River Community Health Center, and the telephone number is 519-732-6375 by phone, text, or WhatsApp. In Delhi, the phone number is 519-586-2323, extension 269. In Chatham, Kent, the service is provided by Chatham Kent Community Health Center. Phone number is 519-397-5455, extension 117. And in Windsor, Essex, Leamington area, the service is provided by Windsor Essex Community Health Center, and the telephone number is 519-997-2828, extension 503.
Many workers in the Seasonal Agricultural Worker Program have additional private insurance provided through Great West Life or Cowan. You will know that you have this insurance if you have a white card similar to the one in the top right-hand corner. There are also deductions off your pay for this insurance because you pay for it. In addition to life insurance and short-term disability insurance, it also covers some healthcare expenses that are not covered by OHIP. These include prescription drugs, medical supplies such as braces or physiotherapy services, which are often helpful in treating muscle strain or injury. Prescriptions, medical supplies, and physiotherapy services have to be ordered by a medical doctor. Treatment by a chiropractor or foot care by a podiatrist is also covered. Dental care due to an accident or emergency is also covered. And by emergency, this may mean a toothache that just comes on all of a sudden. Regarding ambulance services, there is part that is billed to the patient, and this is covered by this insurance. It might also cover other services or tests which may not be covered by OHIP, and these would have to be checked into. There are limits to the amount that is covered for all of these services.
This video was produced by staff from the Occupational Health Clinics for Ontario Workers, or OHCOW.